very happy to welcome you to today's sessions, and we will open today with
Good
Marta
morning,
Sancho from
everybody, to
the
the second day of
HLA's
the virtual
Hermosa
fertility fair.
Reproduction Center
We are
from Spain.
very
Good
happy
morning,
to
Marta.
welcome you
Welcome to the show.
to today's sessions, and we will open
Good.
today with
Marta
Marta
will
Sancho from
tell
the
us this morning
HLA
about
Vista
guarantee
Hermosa
programs, secure IVF,
reproduction
and
center
healthy baby
from Spain.
programs as they
Good morning,
operate in
Marta.
Vista
Welcome
Hermosa
to the
clinic.
show.
Good
We're
morning,
very
Thorsten.
excited
Thank you.
to hear the news and to hear
Good.
your offer.
Marta will
Marta,
tell us this
stage
morning
will be
about
yours in a
guarantee
second.
programs,
You can
secure
now share
IVF,
your
and
screen,
healthy
and
baby programs
afterwards
as
we
they
will have
operate
our
in
question and
Vista
answer
Hermosa
sessions.
Clinic. We're very
That
excited
will
to
explain the
hear the news
questions
and to
from
hear
the
your offer.
visitors and from our audience,
Marta,
and
the
we can
stage will
directly
be
answer
yours in a
all
second.
the
You
questions.
can then share your
Okay,
screen, and
so
afterwards
the
we will have
stage
our
is
question and answer
yours. Please share
sessions
your screen.
where I then will display the questions from the visitors and from our audience, and you can directly answer all their questions. Okay, so the stage is.
Okay, thank you so much. I don't have a presentation as such today, so you're going to see me. First, I would like to welcome you to this webinar and to do a brief introduction to our clinic. So, Vista Hermosa has been nurturing life for over 35 years. Our headquarters are in Alicante, but we are part of a group of clinics throughout Spain in Latin America, the UR International Group, that work together to improve our treatments and patient care. All our clinics are inserted within hospitals, which allows us to have multidisciplinary teams of experts available for our patients. This can help to provide a more comprehensive care, including, for example, nutrition tips, radiological tests, whenever necessary. And as a group of teams, we are constantly researching and updating protocols. We are always searching for the most advanced and top-of-the-art techniques in order to provide our patients with the best possible services and with a personalized care. And I emphasize the personalized care because for us it's very important that each patient feels unique and that they feel that they receive the attention that they deserve, because we know that assisted reproductive treatments can be very stressful, and we like to think that we provide patients with a relaxed and trustworthy atmosphere. So with the latest advances in assisted reproduction techniques and in genetics especially, we are now able to provide new services and new programs to our patients. Today, I'm going to speak about 3 of these programs, the guarantee programs, the secure IVF programs, and the healthy baby programs. Starting with our guarantee programs, these were created because the latest technical advances and the excellence and experience of our experts allow us to guarantee that the patients will have a baby at home at the end of 3 cycles, or we will refund up to 100% of the assisted reproduction treatment costs. So our main objective is always to provide our patients with the best quality in both services and in treatment. And for that, we have guarantee programs for IVF, eggs and sperm donation, with egg donation and own sperm, for double donation treatments, and also for embryo donation or embryo adoption treatments. There are some medical exclusion criteria for each program, such as having had recurrent miscarriages or uterine malformations, and also severe sperm alterations will also imply that the patients cannot apply to the guarantee programs. However, if you're admitted into the program, everything will be included except for travel costs and pre-treatment tests. In order to explain a bit what the program include, I'm going to list a few of the items. So all programs include fresh embryo transfers. They include the latest techniques such as MAX, time-lapse, and the use of PhenoMatch for donor matching in case of donor egg donation or IVF with sperm donor, among others. We also include the donor medication for egg donation and double donation treatments, and patient medication, except for overseas patients or countries with border restrictions. Due to COVID, border restrictions have increased in some countries, and this does not allow us to send medication to the patient, but this is also taken into account when we prepare the contracts. Stimulation monitoring is included, also with all ultrasound scans and hormonal blood tests whenever needed, egg collection and embryo culture, if possible, until blastocyst stage, embryo freezing, and 1-year vitrification of any surplus embryos. Also included are all frozen embryo transfers if we haven't achieved the pregnancy and healthy baby at home at the end of after the first transfer. Also very important, there are no waiting lists for our programs, and the patients can pay the total cost of the guarantee program in installments. They pay 50% at the beginning of the treatment and then the rest during the following 6 months. Also very important to know is that patients will receive a contract with all the clauses of the program at home, in their home, to read through before they sign and start the programs with us. Our programs have very competitive set prices, and our patient care department can provide all the necessary information for patients to start the process. We used to recommend patients to come to our clinic to be assessed by our medical team in person, and we still recommend that because it's a way that patients can get to know the clinic and get to know the team. But we also know that with the current pandemic, it is difficult to travel often abroad. So if patients can provide us with the results of the necessary tests to be assessed and evaluated by the medical team, we can then confirm if they are if they enter the program, if they are eligible for the guarantee program without having to travel to us. If you come to our clinic, then another advantage is that you're going to leave with all the necessary medication. So at the clinic, since we're part of a hospital, we can provide you with the medication that you will need for the treatment. If you don't come to the clinic for that first appointment, we can send directly the medication to their home, except once again for overseas patients or patients living in countries with border restrictions. Our medical team is always available to discuss the different stages of each treatment and its outcomes. We can do this either in person or by phone or video call. We also do follow-up inquiries during the pregnancy and keep in touch with the patients until after the babies are born. This usually is done through the international department, but if the doctors need to speak with the patients or if the patients need to speak with the doctors, we can always arrange that. The second program I would like to present today is our secure IVF programs. And thanks to the advances in lab techniques and in genetics, we have been able to improve the chances that our patients have healthy babies at home at the end of their treatments. And this is something that it's becoming more important every day. We can perform PGT, which is the pre-implantation genetic testing, to embryos to ensure that we are going to transfer only embryos with normal chromosomes. This technique can be used with own gametes or with donated gametes. It can be specially recommended for specific cases, such as women over 40 years old or men with altered sperm FISH test results, but it can also be used for patients who have suffered from implantation failure or recurrent miscarriages and want to make sure that the best chances of having a healthy baby, want to ensure the best chances of having a healthy baby at home by eliminating before the transfer all embryos that will not implant or would end up causing miscarriages or babies with syndromes. So we call these programs secure IVF programs. And at our clinic, since we have our own genetics unit, we are able to perform the PGT and have the result in 24 hours, thus allowing us to go ahead with a fresh embryo transfer. This is also very useful for international patients because we can do everything in one cycle and they don't need to travel to Spain more than once. If needed, we can also provide patients with genetic counseling to discuss the results of the cycle when the results of the PGT are not favorable or when the patients have any questions regarding the results presented. And last but not least, I would like to introduce you our Healthy Baby program. Following this desire to give as many guarantees and as much safety as possible to our patients, we have created these new programs. We use the latest genetic screening techniques to search for genetic recessive illnesses, such as cystic fibrosis, which is one of the most common and most recognized recessive illnesses. And we do these screenings in order to minimize the risks for patients having children with recessive hereditary illnesses. So recessive hereditary diseases are a set of rare genetic diseases that develop only when two carriers of the same illness have a child together. They are rare. The incidence is of about 1 in every 300 children in the most common of them. But if we want to make sure that this incidence is even rarer, then the patients can choose to do the genetic screening. The patients and the donors may not know that they carry altered genes because it's a recessive illness and it has not manifested itself in their close families. But when the gametes of two carriers of the same mutation generate embryos, then there's a 25% chance that the offspring will be affected with the illness. We can either test both patients in case of using own gametes, or we can test a patient and a donor, and we make sure that they do not carry the same recessive illnesses. In the case of patients, of course, if they have the same altered genes, we cannot switch the patient. So what we would be doing, we would be performing PGT, the pre-implantation genetic testing, to the embryos to ensure that this illness is not passed to their children. Not all diseases can be detected by PGT. So each case is analyzed individually by our lab and by our genetics team and discussed with the patients and with the geneticists. If we are using donor gametes, then the answer is very easy. If the patient and the donor share the same recessive illness, then we simply search for a new donor, making sure that we have a healthy genetic match. Our secure match panels can study either the 15 most common genetic illnesses, thus already reducing greatly the risk of having an affected child, but we also have a more thorough extended panel that studies over 500 genes for those patients who want the risk to be as reduced as the current techniques allow. With our 3 programs, the Guarantee Program, the Secure IVF Program, and the Secure Match, we provide our patients with the best and safest techniques so that they can have their healthy babies at home. And that's the ultimate goal that we all work for. We will continue to introduce new programs, and we expect to do so next year. And we will continue to improve our services so that patients can continue to trust their dreams in our hands. And I hope that with the information that I have provided today of our programs, I've been able to shed some light into the new techniques and new services that we can provide patients nowadays. And if you have any questions or you would like to know more about any of the programs, you can always get in touch with our team. either at the fertility fair through the stand or using our contact information that you can also find at our stand. Thorsten, I don't have any more information to provide to the patients. I don't know if they have any queries that I can help them with.
Okay, yes, we do have questions. Thank you very much, Marta, for your presentation, for the information. I think this was very helpful, very useful for our audience, and we have received a set of questions. I will now, one after another, show them on the screen and read them. So, first question is, do you make medical visas for the patients outside of Europe?
Okay, we cannot provide visas because this is something that's done either through the consulate or through the embassy. But we do provide medical letters explaining the need for patients to travel to our clinic for treatment. And this serves as part of the set of documents that patients present when they do a visa requisition. And hopefully this helps provide them with the necessary visa to travel to us.
Okay, perfect. Next question is, does carrying 2 embryos increase the chances of pregnancy?
Well, that's a very tricky question because statistically speaking, and in general, if we transfer 2 embryos, then the chances of achieving a pregnancy are a little higher, not double, but usually about a 10 to 50% higher. But recent studies have shown that in women with immunological problems, transferring 1 embryo guarantees a healthier pregnancy than transferring 2. And also transferring 2 embryos means the possibility of a twin pregnancy, which is always riskier than a singleton pregnancy. So this answer is usually best answered by a doctor for each specific case.
Mm-hmm. Individualized. Good. Next question is probably an easy one. Do you provide Skype consultations for foreign patients?
Yes, we do. We've been providing them for several years now, but with the pandemic, this is something that we do daily.
Okay, and do you mainly use Skype, or do you use all the different platforms like Zoom also, and Teams and WhatsApp? And
we usually use Zoom more often than Skype. We also use Skype, and now and again we use WhatsApp. We haven't used Teams a lot because we found out that we have more problems with that platform. But we are able to adapt if patients need to use a different platform.
Okay. Next question is, what is the success rate? What else can we do to get even higher results?
Well, the success rates depend on the treatment. In our webpage, you can find a bit of information about success rates for each specific treatment. And what we always do is once we have done the first appointment with the doctor, during which we assess each case individually, then the doctor can provide the success rates for each specific case. To get higher results, it depends a bit on the treatment that we're speaking about. Always, the treatment with the highest success rate is the double donation treatment, followed closely by the egg donation treatment. IVF with own eggs has many factors, and those factors need to be accounted for before we can give an accurate success rate.
Okay, understood. Good. I don't see further questions now in my chat here. So I believe this was it. Thank you very much, Marta. That was a very good opening session to this weekend part of the Fertility Fair. We will have more presentations throughout the day. The next one will be at 12:30. Might be a little bit delayed, but at 12:30 will be the next speech from Dr. Yulia Volkova from the Genesis Medical Center. We're looking forward to that. And in the meantime, make sure that you visit all the stands from the companies, and you can there also directly chat or WhatsApp with Marta, for example. She will be at the booth and in the booth of all the other clinics and companies as well. Okay, so let's enjoy this live event. Let's get all the answers to our questions. Thank you very much, Marta, again for that webinar, and talk to you soon and see you around at the fair.
Thank you so much, Thorsten. Have a nice day. Bye.
Bye-bye.